Hello, my name is Aditya Lodha. I'm one of the co-founders of the Current Events coverage, the Current Events Chronicles, and today we're on an episode of the Current Events coverage, our podcast. And with me today, I have a friend of mine. Her name is Radha Gupta, and today we're going to be discussing the coronavirus and public health in relation to infrastructure of various countries. So Radha, would you like to introduce yourself?
Yeah, hi. My name is Radha Gupta. I'm very interested in the intersection of global health and economics, which is something that I'm probably going to be majoring in while I go to Chicago next year. Specifically today, we were going to look into how the government in countries like China versus the US and maybe countries like India and Africa contribute to how the coronavirus pandemic has affected each of them.
Yeah, sounds great. So I guess the first question that I want to ask is a pretty general question is how is, I guess, our response differed from other countries like you just mentioned, like China or India or the continent of Africa? Like how does it differ in your opinion?
Okay, so China's an authoritarian government, meaning that they have certain abilities that the US nor India nor Africa could do, which is when the coronavirus pandemic started, they were immediately able to shut down traffic. They control all aspects of life, including the economy, what news gets taken out. So it's very easy to control a population like that. Further, in terms of social distancing, our country is very focused on individual freedoms and personal responsibility. So in China, they were able to send out military personnel that made sure that people stayed within their homes. And they have very active and complicated governmental surveillance systems, which ensured that people stayed inside their homes and followed protocol.
Yeah, I also feel like at home we have like a lot of like politics and like partisanship, which obviously really differs in the response to the coronavirus. Like we had the former administration of President Trump, who had some pretty interesting views on the coronavirus and how to deal with it. Now we have President Joe Biden, who has starkly different views on how we have to go about dealing with it. And I guess that like what you said about China is like rings really true because they are rapidly efficient. They're very authoritarian, and I guess that in times of global crisis and global pandemic like we are in right now, it really helped China out to just mobilize and to just like blast through this thing. Whereas we were arguing a lot in our governmental structures and institutions about how best to deal with it. How do we roll out vaccines? Should we even use vaccines? There were just many different aspects which we were debating over, which is quite obvious because the nature of our country is that of a democracy, and and the response was just completely different. It may be better in some ways, but I would say very different from China, especially.
So with the US, we debate over everything, whether that be budgets or how we spend our money in social service programs, what role government plays in social well-being. And when you have a constitution and political parties and you constantly are arguing about this kind of stuff, handling a pandemic is very difficult. We've not given our government the power to just take charge like in China. And therefore, every single governmental action that had to take place was a debate about whether it would happen in federal or state level, the extent to which government should be involved, how much money they should be giving. And additionally, whether risking your well-being by going out, should that be a personal risk, something that people make the decision for themselves, or is that something that government needs to control as it is a highly contagious pandemic?
Yeah, I also feel like in China, like people's lives are really dictated by the government, and people listen to their government, whether it's out of fear or love for the Chinese Communist Party. People tend to listen to the Chinese government, whereas we have a very different relationship with government and public health in America. I feel like in America, oftentimes people on all sides of the political spectrum don't believe that the government is working for them to help them. Whereas, if you go to countries like, I guess, Scandinavia, if you go to the Scandinavian, region, and you go to countries like Norway and Sweden, you know, people tend to have a very different view about public service and government because they feel like the government is actually working to help them and they trust the government. And unlike over here, and the government really hasn't, given its people, given the American people, like, a good track record to go on for trusting it. And as we saw, with COVID, how we had these incredibly high, contagion numbers and deaths. So yeah.
So I think I agree with how people don't trust our government. Again, it comes down to how much we think the government can handle the situation. If we see our government arguing about whether or not this is a state responsibility versus a federal responsibility, and we have conflicting opinions coming from the CDC, while this is, yes, all new, but from the point of view of an American, watching the CDC say yes masks, then no masks, to having governors institute lockdowns for 2 weeks that extended outwards, it gives off the impression that our government does not know what's happening, which is, it is a new pandemic, but it also causes people to lose that trust. Additionally, we don't have a public healthcare system. So in China, their healthcare system is pretty much covered by the government, and it's been handling the healthcare system for a long period of time. So we have a blend between public and private healthcare. So a lot of people who have private healthcare fear governmental public healthcare because they don't really know much about it. And the governmental healthcare system has never had such large numbers of people to take care of.
Yeah, and like you said, like it's the first time like it's been happening. So obviously, like everyone has to be understanding of like what's been happening. But at the same token, it's quite hard to be understanding when you have hundreds of thousands of people dying each and every single day, like we've seen it in India, like right now. And yeah, and the biggest problem, I guess, with America now, India is experiencing it, was that when COVID first came, we had no pandemic or epidemic plan in place at all, and you could just see how bad it was on the healthcare system and the hospitals. They just got overwhelmed. They were rushed. They were torn apart. And I guess that kind of feeds into like America's stance on in terms of foreign policy and like on public health issues. Like we tend to be very reactionary rather than preventative. When something bad happens, then we react to it. Yeah, we're scrambling, but we never take steps to prevent it. And I'm not saying that like, oh, of course anyone could see this coming, but we tend to have that policy of of dealing with the punch after it comes, if that makes sense.
Yeah, exactly. For example, with COVID, we shut down travel a lot later. The idea of a lockdown came after we had a lot of COVID deaths already happening. When COVID was spreading in nursing homes, we were not, like you said, we were quite reactionary. When comparing the COVID crisis between the US and India, we have to like recognize that India is a newer country, a newer democratic country. It's been around for less than 100 years, basically, as a democratic independent nation. And when the US was around for less than 100 years, we had Articles of Confederation. We had no idea how to control the government. We didn't know what each branch of government was supposed to do, forget handling a public health crisis. So when you look at India from that point of view, you have a massive population of over 1 billion people, and you have not yet set a definite functional government.
Yeah, I completely agree with everything you just said. Like they are a very, very new country, and not to mention that they're a really fast rising country, economically speaking, socially, culturally, all that stuff. But they are still developing. They're not at the level of countries like China or the US or Great Britain. They're getting there, and especially when you have so much of the population being rural, and the culture, like you and I are both from India, and the culture over there is to meet, to gather, to like go to weddings, to go out with friends, to talk, to have many people in a confined space. And for the most part, like in the beginning of the pandemic, in the first year or like 9 months, India was doing pretty well, and I think everyone expected India to get obliterated, but India was doing pretty well. And then they were getting complaints, and people were having weddings again. It's just the culture of the nation to just group, to talk, and to be together in a social setting. And I think that really saw a skyrocket in the number of cases. Not having a proper vaccination delivery system, so many aspects in the infrastructure, which really contributed to like what's all the death and devastation that's happening over there right now.
Yeah, of course. And I think the idea of people becoming complacent has also happened in the US. You can just see today, Governor Ron DeSantis has officially ended all COVID-related executive orders there, and we're getting ready to return to normal. Even in New York State in May, we're supposed to all COVID restrictions are going to be lifted. Now, the difference is that while you're complacent in India, their population is over 1 billion people, and trying to get a vaccine rollout to all those people without infrastructure is nearly impossible. While in New York, about half of adults have received their first vaccination, and the number is growing every day. So the tiredness and the exhaustion from social distancing and losing the social aspect of your lifestyle is easier in this country because we've been able to combat COVID. But also in India, we have to remember that their infrastructure lacks in many different areas. So for example, in terms of laws and police, bribing is very present there, in which you could bribe police officers and get away with throwing a party. Now, that might be possible in America, but not in the wide scale that it is available now. And another thing we have to recognize in India is, even though their fast-growing, strong economy gives the illusion that it's a wealthy country, you have such great wealth disparities there that's even more extreme than you have in America. So in America, we do have poor people, we have homeless people, but in India, it's so much larger. You have people who can't even afford hand sanitizer. You have people living in slums who physically cannot social distance from others. And as you mentioned before, these rural villages are so away from others that testing capabilities aren't there. You barely have functional hospitals that can deliver babies, forget taking care of COVID patients.
Yeah, like right now, one of the biggest problems that India has, in relation to like the public health crisis is like they don't have oxygen tanks, they don't have enough spaces in hospitals for beds. So they're right now operating at like max capacity, and there's only so long an institution, a country, a government, whatever can do that for, and eventually it's going to break, and it's going to break pretty badly. And like you were saying, like it's so rural and it's impossible to get the word out. And you can blame them at the same time, but you can't really, because it's still developing. It's still developing an infrastructure. It's still developing a proper healthcare system, and those kind of things, I guess, only come with time, and the virus just really kneecapped all of that in a really just bad way.
Mm-hmm. So now looking forward, another concern with India could definitely be that this is definitely going to spread, but it's also, while the pandemic was hitting our country, our biggest fear was that the hospital system is going to be overwhelmed. We kept hearing it, that the hospital system is not going to be able to handle the influx of patients. Now, we never really reached that level. Yes, there was lines outside of hospitals, and yes, they were running low on PPE, but what you see in India is a complete collapse of the healthcare system. Now, the issue with that is that if this COVID pandemic continues to rage through the population, which it seems like it will, people will have lost all faith in government. And so you're going to turn to other ways of trying to protect your health. Like if you're in a desperate situation, you know somebody with COVID, your parents have COVID, your kid has COVID, you're going to go to drastic measures to try to protect your family, protect your people. And if you don't believe the government is going to do that, there's going to be lawlessness.
Actually, yeah, I never really considered that until you brought that up, because like desperation does lead to crime, and in times of public crisis, like crime does skyrocket. So completely, like lawlessness could skyrocket, and I guess that could cause cases to surge as well. And I guess like this just goes back to the importance of how necessary it is to have a proper public health system, and just infrastructure in general, like transportation, means of rolling things out, means of communicating with the population on a mass basis. Many people in India don't have TVs, like because many of India is still rural and industrializing, which is, again, takes time. But yeah, time is something we don't have right now, with over, what was it, like 200,000 people getting infected per day. Like time is a commodity that like we can't afford, and we don't have. And we really, I guess the way for India out of this pandemic is going to be a lot of international and just outside support.
Yeah, so with a lot of developing countries in global health, you have to look at the interaction between other governments and private institutions. Like, for example, the Gates Foundation, that's a private institution that does a lot of work to combat whether it's malaria, helping with education, they do a lot. And then you also have governmental agencies like the UN, the World Health Organization. And so currently we're seeing the US starting to give aid to another country, but I think this kind of relates to the America First principle, where we saw that especially with Donald Trump, where he was focusing on our own country. And I think this idea has still stuck with us. I think the majority of people would want our country to get vaccinated first before we start sending out our supplies to other people. But a major question that we're going to have to deal with is, at what point do we start shipping our vaccines away? There's a huge amount of the population that's not going to get vaccinated. They're against the vaccine for whatever their reason is. And so should we keep enough doses to vaccinate them at all times, or should we start sending away our resources to other countries?
Yeah, I mean, completely. I guess like that's a really important debate, and the way I see it is that with the America First policy is that let's say that there are two people drowning, right? You can't help the person who's drowning if you're drowning yourself. So I do in a sense understand why in that case Trump was kind of America First, especially with the pandemic, and I guess Biden has kind of followed that tune, and I think that now more so than ever, I think we are in a position to help out India, because what's the number? I think it's been like 200 million people who have been vaccinated so far, which is roughly like 2/3 of our country. So it's not bad, of course, but we still have a long way to go. But I do think that now more than ever, we are in a much better position to help out, especially with a lot of this country has a lot of Indian immigrants, many of whom are in a fortunate position to send aid back home, and I do think that now is a time, if any, to turn our attention to the international sphere and helping out our allies and other countries.
Yeah, it's definitely also important that we help out other countries, because every time COVID spreads to somebody, it mutates. It has the potential and the capability of mutating. And so far, we haven't found a variant that is resistant to the COVID vaccine. But if we continue allowing this virus to spread amongst the entire Indian population, maybe go to African countries, you're definitely going to see a variant of this virus that you may not be protected with by the
of course. Like my mom, like a personal story, like my mom knows an Indian doctor who got both doses of the vaccine. He's a healthcare worker, and he flew back to India because and to take care of his parents and stuff. And he got the mutant strain of the Indian coronavirus, of the strain of the Indian subcontinent, and he was dead within days. So just because you have both doses and you think you can travel, especially to like this Southeast Asia and a hub where COVID is booming, does not mean you're safe at all. He was just one of many people who was vaccinated, who went back and then sadly passed away because the virus mutates really fast. We had strains in South Africa, we had strains in Brazil. Again, not still developing countries. Obviously, Brazil has the favela problem with all the slums and stuff too, kind of similar to India. And we saw the Brazilian strain mutate like crazy.
Mm-hmm. And these mutations are quite contagious, and it'll rage to a population that's plagued with other healthcare issues, like India and even African countries. In the US, the leading cause of death is heart disease. Drug use is up there. You have a lot of these other diseases, but in India and African countries, the leading causes of death include illnesses like AIDS, malaria, diarrheal diseases, and even like road injuries. So the healthcare issues like with diarrhea, AIDS, which attacks your immune system, leaves the entire population vulnerable to getting COVID. So in our country, how we prioritized people with underlying health conditions with getting the vaccination, these people with underlying health conditions are very widespread. And another thing to consider is that we've seen the virus ravage through many populations. We've seen it go through Europe, and Italy got hit hard. We got hit hard. Brazil, and now India. The one area that, yes, there was a South African strain that it hasn't hit so far as hardly is sub-Saharan Africa and even parts of the Middle East like Yemen. And the issue with that is the infrastructure there is absolutely terrible. Their economy isn't even as great as those in India. It's a very developing area, and you have many diseases like AIDS is incredibly prevalent in sub-Saharan Africa. I think 66% of AIDS cases happen in sub-Saharan Africa. And when you have such a vulnerable population, the question is whether you can beat the virus through vaccination and aid. The virus is going to come anyway. It's just whether or not you can get there first.
Yeah, I think you've again made a plethora of amazing points, and and to just first start off, like when you made the point about how a lot of these places have underlying health problems, and really bad underlying health problems, because obviously they're developing areas of the world, the Middle East, Africa, South America, and things like malaria. And it scares me, and I think it scares many people, that if those areas and countries are barely able to deal with things like malaria and AIDS, due to their lack of infrastructure, when COVID comes, boy, it's going to be a storm. It's going to ravish through the population. And I guess this kind of plays back into what I was talking about before, actually being preventative rather than reactionary. And I think we have a real chance to see this and to take a preventive measure from the UN, from the World Health Organization, in areas like South Africa and the Middle East, because if India was bad, those are going to be even worse, as in fourth, fifth, and maybe sixth waves, devastating the population and those countries.
And this just goes back to an earlier point that we both discussed, which was what's the role of the government versus what's the role of private institutions. We've seen a lot of our billionaires in our country donate a lot of money, and they're responsible for a lot of changes. Now, should we place all our faith in independent private companies or independent people to help save other countries, or do we need to ask our own government and overcome our own, I guess, ideological differences about the role of government to help the other countries?
Yeah, I mean, of course, like when it comes time to a problem, when a family, when an institution, when a government, when a country, when a people have to deal with a problem, you cannot be divided. And say whatever you will about China, their human rights abusers, whatever. They handled the virus very well, because at the end of the day, the Chinese Communist Party, this authoritative regime, is authoritative. It doesn't have any opposition. It doesn't have anyone to cross-check it, to fight back against it. And in this case, it really helped China out. Like you were saying, they were able to be ruthlessly efficient with stemming down cases and just getting this virus under control, which we all have to do. We need to put aside political divisiveness and just work together in our country domestically and as a member of the international community, and be an upstanding example for other countries going through this, because there are going to be fourth, fifth, and sixth waves in many other developing parts of the world.
And it's also very important for us to get involved and try to end this pandemic, because at some point it's going to come back. At some point, the virus is going to mutate to a point that we're not protected, and then it's going to come back to our population. And so again, like you said, we're going to have to take a preventative measure, even if that means spending a lot of money on foreign countries. At the end, it will help us. We would rather be in that place where we're spending a lot of money up front preventing the virus from mutating, rather than having to go through the lockdowns, the economic downfall, and all the social distancing and the struggles that came with COVID having to hit again to our country.
Yeah, and obviously, as important as it is taking care of our own country first, which it is, it's also important to help out other members of the international community, because even if you're looking at it from a completely non-moral stance, India and China are our biggest trading partners. When they do well, we do well. And I guess that's just the philosophy behind it. When everyone else does well, we prosper as well. And and the coronavirus doesn't really care about that at all. So I guess we all really just have to work together.
Of course.
So I guess that's it. Radha, thank you so very much. There will be links in the description below to donate to India, a bunch of GoFundMe. So please donate if you can. And once again, Radha, thank you so very much.
Thank you for listening, everyone.